So I think we have a mixed audience here. So my talk will include some basics and also some, of course, we will cover the details. So I hope there's something interesting for everyone and you will find it interesting and exciting. There are 4 valves, as we know, and 3 of them cause problems in adult patients: the aortic valve, the mitral valve, and the tricuspid valve. So if we start with the mitral regurgitation first, degenerative mitral regurgitation, the most common cause in this country, we do have a lot of rheumatic heart valve diseases, but in the cities like in Kuala Lumpur, the most common cause is degenerative mitral regurgitation, and typically due to chordal rupture, where one of the cords which supports the mitral valve has ruptured, causing the leaflet to prolapse and with resulting mitral regurgitation. We also can have myxomatous disease, and this diagram shows a more extreme form of myxomatous disease in Barlow's disease, where we have lots of excess leaflet tissue so that there's no coaptation between the leaflets with resulting mitral regurgitation. Rheumatic mitral regurgitation is common in this country, as well as rheumatic stenosis, and that is due to fibrosis of the valve leaflets. So this is an example of a patient I treated some time ago. She's 71 years old and she had been previously fit and well, and then suddenly she felt she was short of breath. She couldn't go shopping anymore, and this is what we found on echocardiography. You can see these are the 2 leaflets, that there is a ruptured cord, which you can see there, with the resulting that the posterior leaflet is prolapsing, and then there is significant mitral regurgitation. And her heart, the left ventricle, had dilated mildly, and the ejection fraction had gone down a bit. And the regurgitation was graded as moderately severe with an ERO of 0.4. The coronary arteries were normal. So we have a question for you now, and I think, yes. So how would you manage this patient? I think you could choose your answer, either optimal medical treatment or optimal medical treatment with mitral valve repair surgery, or optimal medical treatment with mitral valve replacement surgery.
To all attendees, the poll is now open. You may choose your The poll is now closed. 22% chose answer A, 56% chose answer B, 22% chose answer C.
Okay, so so in that particular patient, clearly with the valve, with the mitral regurgitation, the problem of volume overload results from the leaking heart valve. And if we were to leave that alone over time, there is then this pathophysiological process occurs where there's progressive stretch on the walls of the ventricular chamber, a slow loss of cardiomyocytes over time, and then with time, with myocardial fibrosis will set in with reduced contractile function, and conduction abnormalities and heart block will result. And if left untreated, further heart failure will result with activation of the neurohormonal systems as well as the autonomic nervous systems. And these patients with severe mitral regurgitation are at risk of sudden cardiac death, and this can be a result of ventricular arrhythmias or bradyarrhythmias, or even an acute contractile failure of the ventricle. So the whole point of management of these patients is to interrupt this cycle, preferably to prevent all these processes from occurring. And the earlier we intervene to stop these processes, the better the outcome for the patient. So what has happened in that patient typically is what is shown here. A cord of the posterior leaflet has ruptured, and the patient has developed mitral regurgitation. So in this particular patient, in the case of degenerative mitral regurgitation, where the primary pathology is a mechanical problem, the best treatment is to repair the valve, to fix the mechanical problem, and to prevent the pathophysiological processes from occurring. So there are various ways to repair the mitral valve, and this is just one of them. This particular patient had a condition which is probably the easiest of all the lesions to repair, because the problem was that of a ruptured cord. So to repair this, all we need to do is to replace the ruptured cord with a new artificial chordae, which is made of Gore-Tex. And this is illustrated in this diagram. In the case of patients who have excess leaflet tissue, we can repair the mitral valve by means of leaflet resection to restore the two leaflets of the mitral valve to the correct shape, and so to restore the competency of the mitral valve. So the risk of surgery in this particular patient was about 1%. We have various ways to estimate the risk for the patient. We use the Euro score. The Euro score was 0.95, so that translates to a risk of 1% for surgery. And she had a 5 to 7 day stay in hospital, which is quite typical. After 4 weeks, she is fit enough to drive again. The full recovery is 2 to 3 months after surgery for the wound to heal completely. After mitral valve surgery, it is important that the medications are continued. So after mitral valve repair surgery, they need to continue on antiplatelets for 1 year. Some would put them on anticoagulation, but in most cases, we treat them with antiplatelets with some aspirin for 1 year, and that is sufficient. It is important to control their heart rate and blood pressure after mitral valve repair. And the lower the heart rate, the better, and the lower the blood pressure, the better. You can think of this as minimizing the stress on the repaired mitral valve. So it's important to maintain them on medications as well after surgery, and as well as medications to promote reverse LV remodeling if the left ventricle had already dilated. And of course, important to remember that even though we have repaired the mitral valve and not replace it, antibiotic prophylaxis is also important for dental procedures to prevent endocarditis. So in this patient, she had aspirin for a year, beta blockers if the heart rate was above 80 or she's hypertensive, and then one of the medications for LV reverse remodeling, either an ACE inhibitor, an ARB, or an ARNI until the LV returns to normal size. The natural history of severe degenerative mitral regurgitation is well known, and this is one of the early studies published by Meng et al. In 1996, where he looked at what happened to patients with severe degenerative mitral regurgitation treated medically. And you can see that if we treat them just with medications, at 10 years, 90% of the patients would either have died or have needed surgery, 80% would have needed surgery, 60% would have gone into congestive heart failure, and 30% would have gone into atrial fibrillation. So in other words, this is a condition in which the patient will need surgery within the next 10 years. More recently, we now know that the earlier we do the surgery, the better the outcomes for the patient. This is a study from the Cleveland Clinic, and where they've demonstrated that in patients who have mitral valve surgery, when they are asymptomatic, when the diagnosis of severe mitral regurgitation has been made, if they undergo surgery at that stage, their 20-year survival is a lot better compared to patients who wait until they develop symptoms before they have surgery. And if they wait until they have severe symptoms when they're in NYHA class 3 or 4 before they have surgery, then their 20-year survival is not as good. So and that has led to the change in the guidelines now to recommend surgery for severe mitral regurgitation if the mitral valve can be repaired even when the patient is asymptomatic, because the long-term survival is much better in this case. And we know also that comparing repair versus replacement, it is much better to repair the mitral valve than to replace it, because it is all your own tissue, and the survival has been shown to be better. But of course, it is not always possible to repair all the mitral valves, but whenever possible, it is best to repair the mitral valve rather than replace it. In most cases of degenerative mitral regurgitation, it is usually possible to repair the mitral valve with very good results. It is a little bit more challenging in the case of rheumatic mitral valve disease, where a valve replacement may be needed. Thank you for participating, for joining us today. Thank you again to Novartis also for organizing this. I'm happy to take any questions if you have any. Thank you very much.